So we're uh, uh, very grateful to our sponsors, and I'm obviously particularly grateful to this sponsor since this is my academic institution. And I don't want this is not to sell you. This is just to inform you about what my university, as one example, has to offer for your staff, your employees, whatever, in terms of opportunities. It might just give, if you're in academia, might give you some ideas of things you want to pursue. So I don't want you to think about you have to sit here and listen to my institution recruit you, but it's a privilege for me to introduce to you Edlin Delano, who's from our business development and group. And I have to laugh because Praveen wanted to do a Six Sigma review on her because of the business development title. But they're there to give information, and we have our service partners are really critical in terms of helping to give the opportunities for our students, undergraduate and graduate, and hopefully we can do something for your team. So Edlin, take it away.
Thank you so much, Dr. Nelson. Thank you all for having me today. I'm happy to share information about our online programs that we do offer, some of the benefits for our online students. Again, my name is Edlin Delano. I represent our online division with the business development team, and I'm happy to share this information with you today. So let's go ahead and get started. So just a little bit about the history of West Coast University. We have been around for a while, since 1909. We do have multiple locations, physical locations actually. In Southern California, we have quite a few locations here, but we also have a brand new location, a campus in Richardson, Texas, and also in Miami, Florida. We do offer bachelor's, master's, and doctorate degree programs, not just at the campuses, but also online as well. All right, so we are WASC accredited. This is our regional accreditation for our institution, and our nursing programs from the nursing RN to BSN, RN to MSN, and MSN programs, we are accredited by CCNE, which is the Commission on Collegiate Nursing. And our FNP, our MP programs, I should say, is California BRN approved as well as our LBN to BSN program.
Yeah, Edlin, can I just clarify? It's our not just RN to BSN, but our generic BSN is accredited. Those appear. Oh, yeah. I just don't want them to think it's only our online. I know you're representing.
I do represent online.
I know you do, but I don't want them to think that the pre-licensure isn't. Yes. So I just have to defend the College of Nursing. I'm sorry, I'll stop.
Absolutely. No, you're a good advocate. Thank you. All right, so that's just to give you an overview of the accreditations and approvals that West Coast University does have. And we've worked hard to get these accreditations, and we're really proud to share this information with you today. All right, so as you can see, West Coast University is very active in our communities. So we do serve the community. Now, we don't just support our education of the students that we have for both online and on the ground, but we also support a lot of organizations. As you can see here, some of these organizations might look familiar. They might be local to the area that you're in, but West Coast University does support our community in every way that we can. So these are just examples of organizations that we have supported financially. We've had students do their clinical rotations at some of these facilities, or even just done volunteer work. So these are just some examples of how we are partnered in the community that we do serve. All right, so why West Coast University? There's a lot of different benefits to our online students. We do have classes that start every 8 weeks. So again, this is for our online division, our online courses and programs. So that means we have about every other month we do have a new start. So the next start after November would be January, for instance. So we have a total of 6 starts per year. We can enroll pre-NCLEX, so any new nurses that are just graduating for a BSN or ADN program, we can enroll pre-NCLEX. We do allow the students to complete their RN licensure within 8 months of the time that they do start the program. So that's another highlight of our programs. We do offer part-time and full-time options. So that's a working professional and accelerated track option. So 1 class would be considered part-time, 2 classes would be full-time per term. And then we do really support an asynchronous learning model. So that means that our students are not required to log in at certain days and times. during the week to complete their, assignments or, clock in or log in to listen to lectures or post their online discussions. They do have 2 hard deadlines a week, Wednesday and Sunday evenings, to submit their assignments. Other than that, the programs are very flexible, really designed for working professionals, working nurses, just in general. So again, we do offer a lot of flexibility in our programming. And we do have a really dedicated online support services team as well. They are located locally in California, but they do support all the needs of our students, everything from career services to student services, and also financial aid as well. We do offer military tuition rates for anybody with any affiliation with the military, any military background. And we offer different types of scholarships and grants as well, which I'm going to go over in the next slide. And then we do offer non-traditional transfer credits for, those who have been working in their field, have work experience, that they can apply towards credits, towards a program. It's something that the student does have to apply for at the time that they are applying in the program. And I'll go over a little bit more information about that in the next slide. All right, so why choose West Coast? I did mention earlier the different types of student services that we do offer for our online students, so they are never going to feel alone. Let's see here, let me just go over to the next slide. Again, more resources from Career Services. So for those of you who have been working in your field for a while, maybe somewhere down the line, maybe right now you're thinking about a career switch, Career Services is there to assist our graduates, our students, and their services don't just end at graduation. Basically, they serve our alumni and our graduates after graduation. So their services don't end at the time that the students graduate. We don't guarantee employment, but we do have enough resources and enough, career services staff that can help students, whatever their career needs are. Okay, so we do offer an alumni pathway grant. So any West Coast University graduate is eligible for a 20% tuition savings. We also have a health services partner grant as well. So that means any student that is employed with any of our health services partners are eligible for a 10% savings as well. And then we offer a cohort savings grant. So that can be combined with the health services partner grant. So if an employee of a specific hospital or facility organization that we're partnered with can bring in 2 other students or colleagues, and you're all working for the same, facility or hospital organization that we're partnered with, you can be eligible for an additional 5% savings as well on the tuition. And then we offer a performance scholarship grant as well. This is merit-based. So basically, it's based on your incoming GPA, your cumulative GPA from whatever last degree that you completed. So there's another potential 15% savings there as well. So as you can see here, we do offer many different options, many different possibilities for our students to save on their overall tuition. As you can see throughout the slides, I have my QR code here. This links directly if you want to schedule an appointment at your time to learn a little bit more about all this information or get a better breakdown on the course curriculum or any of the programs that I shared here today. And you want to just get more information or schedule an appointment, please, scan the QR code and schedule some time that works best for you. Okay, so I mentioned earlier about the experiential credits, in other words, the transferable, non-traditional transferable credits. So West Coast University may award credits for skills and gains through work experience. Again, I mentioned earlier, the student does have to submit a portfolio that gets submitted to the program dean or the director of the program that the student is applying for, and it gets evaluated and approved through that way. And overall, a student can potentially save a lot of time and cost there as well. Okay, so I'm going to go ahead and go into our nursing programs. Again, I'm not going to go into full detail about all these programs. I'm just going to share enough information for you to gain some knowledge and information about what we do offer online in terms of our nursing programs. We do offer everything from an RN to BSN to RN to MSN, a Master's of Science in Nursing program. We have several track offerings and specialties, as you can see here. I do want to highlight 2 of the most recent specialties that we just launched, and it's psychiatric mental health nurse practitioner track, that's under our MSN program, and also adult gerontology, acute care nurse practitioner program as well. So, all this information is on here. Again, more than welcome to scan that QR code. I think I'm going to bring it up in the next couple of slides if you want to learn more information about the course curriculum, the course breakdown, timeline. All that information can be shared with you after this presentation. So anybody has any questions, please feel free to let me know, or you can just type that in the chat room as well. We do also offer postmaster certificate programs. So we do require an MSN degree to be qualified or eligible for this program. We do offer the several tracks here as well: nurse educator, nurse leader, and nursing informatics, the FNP program, psychiatric mental health nurse practitioner, and also adult gerontology. I want to go back to the last slide and talk a little bit about the NP programs. We do require 2 on-site intensives for all of our NP programs, which typically take place in the 2nd and 3rd years of the program, okay? And there are precepted clinical hours required for each of our NP programs as well. So I just want to give that information ahead of time for some of you who are asking, are there clinical hours required for the MSN NP programs? But otherwise, all of our coursework for all of these programs are 100% online. Okay, for anybody interested in healthcare and business programs, we do offer that as well. So anybody working in a healthcare field who's not working technically in a clinical setting, or wants to maybe transition into more operations and admin area, but still wants to stay in healthcare, we do offer options as well. For instance, we do have a Bachelor of Science in Health Admin, Business Administration as well, Public Health. We have the Master's in Health Administration. We do have the Master's in Business Administration, also Master's in Public Health as well. We just added a new program as well, which is Bachelor of Science in Public Health also. So again, lots of options out there. Today, really, I just wanted to give you just a basic overview of what we do offer, just so that you can see, what we offer for our online programs. And then our admissions process is pretty straightforward. Set an appointment, apply online, you complete your FAFSA. So whatever your financial situation is, we do have a financial aid team that will help assist you, walk you through the process. And then we confirm your academic admissibility in any of the programs that you're applying for through the evaluation of your transcripts. So students are required to submit that as well. And then the last 2 steps is basically completing an online student orientation. And then also, last thing, you start your classes. So that pretty much concludes my presentation today. Again, there's my QR code. It's there as well. My contact information is there. So I really do appreciate you giving me the opportunity to share, what we do offer online. Thank you so much, Praveen, for having me. Thank you, Dr. Nelson.
Don't go anywhere.
Don't go anywhere. Okay.
Okay.
Yes.
There's in the chat, there is a, one of my colleagues and co-coordinators, Dr. Hedges, is asking about the Masters of Public Health that she periodically thinks about that. So,
Nice.
will that work if she's a full-time dean of a nursing program and involved professionally? Can she?
Yes.
How will that look for her?
Yeah, so the Masters of Public Health program, our programs, like I mentioned earlier, we do offer full-time and part-time. Very suitable for somebody who is working a full-time job. So we don't require anybody to reduce their hours at work or quit their job. And our master's program is designed for a working professional like you. It can be completed in as little as 16 months. If you're going to choose the accelerated route, for instance, so that means you're taking more than 1 class per term. And again, our classes are 8-week terms. So every 8 weeks we have a new start. We just started a new term in September 6th, and then the next starts November 1st. And then after that, will be in January. So think of it as every other month we have a new start term. So please, scan the QR code, let me know if you want to learn more information about that. I can get you more information. Today, I just wanted to highlight the programs that we have and give you an idea of, what we do offer. So hopefully, we do have something that might be of interest to all of you. Anybody who's thinking about maybe switching career pathways or continuing your pathway in the field that you're in, and maybe looking for more of an elevated career move. We have these programs offered to you, and to hopefully help provide you and guide you in that way.
If they're in academia, they cannot switch careers. They have to stay in academia. if they're in service, by all means, come
Yes.
over to academia. Okay, I have I have a couple comments. I'm watching the chat. If anybody has their hands up, Praveen or Tarek, let me know. Will they meet Gabby? Because in my presentation, I talked about Gabby, our virtual advisor. Will
Gabby.
will they meet her if they were to, seek additional information about the programs at
Yeah.
Wesco?
So if they scan that QR code and leave me their information, I can definitely connect them with one of our online admissions advisors, who is going to contact them via telephone, because everything is virtual with us. And they just need to set a time and date that works best for them, and then I do the rest.
Okay, I just, I would love for them to meet Gabby, because and
Oh.
we all have these automated systems, but I
Yeah.
find her to be a little bit more intelligent, this, I
Oh.
think. Okay, also, I wanted just to sort of a shout out again, or a call out to the psych mental health. That program, and it's just starting. A lot of schools are
Yeah.
going after the psych mental health focus. And it's interesting, the number of applicants for that program. I mean, it hasn't even started its first cohort, and I think it's symptomatic and symbolic of the issues that we're dealing with in healthcare. So I'm grateful that there'll be an opportunity for more psych mental health practitioners. The other thing I wanted, and I always find this to be a question that applicants to any school, not just to West Coast, about transfer credit. You mentioned, they review the transcripts. They can, look at what they took. I just feel it's important. And if it's not important, I'm making it important, because when you've taken coursework somewhere else, particularly if you didn't finish a program and you're wanting to start, and I think there was some box that appeared at some point there in Edlin about transfer credit. What you have to understand is each school that you apply to has a different process. Even though you went to the best school ever, University of Texas Arlington or what have you, each school is going to look at the equivalency, and it could be different. So I just want to make sure that any other comments that you have about the transfer credit, because that seems to be one that applicants don't quite understand.
Yeah, I mean, that's a question for admissions, honestly, because they are the ones that are actually going through the transcripts and evaluating them and seeing, really what credits, what classes they took previously can align with the program and can basically qualify as a prerequisite for these programs. So definitely, they will dive a lot deeper into what you can bring in, because definitely, that's something that's overall, it's going to save you time and cost in the long run, right? So you want to be able to bring in the maximum amount of credits that's allotted for each of these programs. So yes, they're all different for each of the programs. That's a good question.
Well, and it is a challenge, because I hear it. I went to UCLA and I took XYZ. Well, but it's up to each individual school where you apply. We do not have a standard process or practice or number. Each schools vary, and I just want to make sure people understand that. You may have to retake something. I hope not. I mean, if you were to go to West Coast and you're not getting the attention that you just described by the admissions people, email me. So that is one of them. Okay, I have another comment about the CCNE accreditation. Well, I'm going to basic roll back. It's to the on-sites. You mentioned that there's on-site intensives for the nurse practitioner. There is an on-ground component for all programs. And I mean, it may not be identified as an on-site intensive, like the 2-day, whatever, but it's really important. Thank you, Deborah. We'll talk about the DNP here in a minute. But anyway, the CCNE accreditation, which all of the programs are CCNE accredited, requires that you have a practice component. And so my big bugaboo is when a school advertises 100% online. Well, you know what? It's 100% of the theory. is online. There is an on-ground component, and I just don't like students or applicants to be misled. It will be in your own community. I think what Edlin was calling out, you're going to have to go to these on-site intensives for the nurse practitioner, but all of these programs in the other, have some kind of an on-ground component. Do you want to talk a little bit about the focus of the DNP, Edlin?
Let me go to that slide really quick.
Yeah. I'm glad somebody brought it up. It certainly is a popular degree across the United States. So.
Yeah, so the student can complete the program in about 24 months, sorry. There is 1,000 hours of specialized practice. And I don't know if I mentioned earlier, we do have a clinical team, an online clinical team that helps place our students. So some schools don't offer that. They basically leave the student to find a facility, on their own, but we do have a clinical team that does help place our students.
And the focus is leadership.
Yes, leadership. So
okay.
Yeah, so the outcomes basically is they're influencing healthcare, policies at institutional, state, federal, levels. They demonstrate clinical scholarship and analytical methods for evidence-based practice. So
yeah, and this is a postmaster's DNP. Yeah. That's also, I think, very confusing to applicants. Is some are post-baccalaureate to DNP, and that's where the 1,000 hours come from. I think some people may have just fallen off their chair about the 1,000 hours of specialized practice. It's post-baccalaureate. So it means that whatever you did in your master's, assuming it meets the, the intent of the DNP practice, those hours will count and can be up to about 500, about half of the 1,000. So the clinical placement team is an excellent, you bet it is an excellent resource, because I hear from students that are panicking about getting their placements for their practicums. And I think that is a definite asset. But I want to make sure that Deborah, you're in terms of the 1,000 hours, if you were a nurse practitioner during your master's, then they would use up to 500 hours from your nurse practitioner, and then another 500 more or less, might be 470, 80, 90 in the DNP. There needs to be an opportunity to apply. And as Edlin described very well, your role as a healthcare leader, you need to have an opportunity to apply that in the DNP. And I think one of the things I'm seeing in terms of the discussions out there, DNP, PhD, DNP, PhD, which, what do you want to do? Well, and somebody said, well, I want to do research. Well, that isn't a clear distinction, because a DNP does translational research. A PhD does original research. That data will be used by the DNP to see if it really does. Is it can they replicate it? Can you reproduce the results? But it's interesting. Those of you that are, if your school is a member of the American Association of Colleges of Nursing, their doctoral conference is coming up in January. I apologize, I don't know where, but you can go to the AACN website, and I saw a lot of abstracts about this DNP, PhD. How do they work together? Are they different? What is the challenge there? So I think thanks for bringing up, DNP, PhD differences are very important. And again, what do you want? Do you want to do?
Yeah.
Go
I
ahead.
was just going to add a little bit, just to clarify, the DNP program, it's a terminal degree. So it's the highest degree available for clinical practitioners. And it's a practice-based degree program as well.
Thank you, because I don't like it when people see them as a hierarchy.
Yes.
They're not. Now, you can certainly have both if you want, but it is a terminal practice doctorate. It's just like the MD, the DDS, the PsyD, whatever, all the Ds. It's one of them. So thank you, Edlin. That's a very, very important distinction to make. And it seems the DNP, Danette's saying, it seems the DNP programs are booming. Absolutely, they are booming. Why do you think they're booming? Danette, do you want to share why you think they're booming? Can you, Danette?
Sure, I can
go ahead.
unmute.
Thank you.
I feel that the demand is there, the practice needs there. They need more nurses who are doing more frontline interventions and frontline care with the population that we have going on right now. And I think the DNP is ideal to try to meet those demands.
Yeah, I mean, it's evidence-based practice,
Yeah.
and it really, and again, it's translational research. It translates what the PhD found to practice to see if it works. So thank you. I mean, that it is booming. And I think another, and I get off track, I'm sure Praveen and Tarek wish I wouldn't, but anyway, you know, the American Association of Colleges of Nursing again has changed the essentials. Those of you that are in academia and know the essentials that used to be the essentials for bachelor's, master's, and doctoral programs. Well, now it's the essentials for beginning and advanced, whether you're, you know, master or bachelor's, master's, doctorate, but the emphasis is on practice. And that's one of the things that kind of got everybody sort of not in an uproar, but they really are not saying that master's programs should have a focus as education, that isn't the role of, you know, of nursing. It's nursing practice. Certainly you can teach, we need you to teach, but maybe you go to an ED program, or it's additional courses, it's not a track. So you'll hear more about this coming up, a lot of discussion about that. Edlyn, anything else you'd like to add?
You guys have really great questions today. Thank you for taking an interest in our program.
I thought of one more. If I'd look at my notes, I'd be dangerous. What about the dual degree? Isn't that coming down the pike, a dual degree?
I haven't heard much, but if it is, I think that would be yes.
Okay.
That would be a great seller.
All right. Well, I believe, and maybe I'm letting the cat out of the bag, but I believe that we're looking at a dual degree between MSN and MBA. Okay.
That would be awesome.
Now, in terms of the whole idea of a dual degree, I mean, obviously it's more units, it's more time, and maybe why MBA, maybe MHA, because sometimes I think maybe a master's in health administration might be more applicable to the service setting than an MBA. But just there are dual degrees are coming, something to think about, more units and more time. So budget is important. Danette, can you elaborate, Danette, a little bit on budget is important?
I'm just me. Obviously hospital administration or hospital costs. Budgeting is so important when you're looking at your patient per nurse per patient hours, your HPPD. All of those things have to take into account. And so having a accounting or an MBA in addition to that nursing leadership is going to be very beneficial to anyone who's in that role. So they look at the big picture and see where they can either budget, cut costs, or take some of that budget to an area that's more necessary.
Absolutely. Now I understand what you were talking about.
Great point.
Yeah, no, that was a great point. Now, Judy posted something that I think is another, and again, more of a profession discussion. It seems some DNP programs are moving students through faster and they're not requiring them to implement their projects. That's the bane of my existence, Judy. I mean, if you're going to be pulling together the DNP focus, and they need to do a project that is implementable. And the other thing that are not just implementable, that it's implemented. And there are some schools, and I won't name them, that are not accredited by CCNE, but another accreditor that allows the focus in the DNP to be education. And that is not consistent with the Commission on Collegiate Nursing Education, or AACN. But I'm with you 100%. Please, if you are going on to get your DNP, anybody that's listening, implement your project. That's how you make a difference in practice. Great point, Judy. Okay.
I wanted to also add real quick.
Yeah, sure, Edlyn. It's your presentation.
The DNP students are matched with the DNP faculty, so advisors. So they're there basically to help them get through the program, help them with the success of the program, and also for that specialized one-on-one mentorship. So.
And that's where a lot of the hours come from. in terms of the specialized practice is in your project that you have to develop and implement. So that's a discouraging part, and whether it's faster is not as much the concern as what have you contributed to practice. So thanks, Judy, for bringing that up. Okay, folks, it is 11:23, and please don't hesitate to reach out to Edlin. There's her QR code. I thought that was scrambled something the first time I saw one of those, but they sort of do work.
Yes, it links directly to my calendar, so you can set appointments.
So if you have questions, but and again, we're all about sharing opportunities so we can bring in as many of our staff, and we need to create new leaders in both service and academia. And I'm very, very grateful, Edlin, for your time. And